Welcome back, everyone. Frontline workers continue the fight against COVID-19. Doctors, nurses, and travel nurses are working long shifts to care for patients with the virus and help them with their symptoms. Our Stephanie Poole speaks with two nurses about their experience during the pandemic, and she joins us now in the studio with more.
That's right, Joey. Many medical workers begin their morning clocking in to full COVID units. With the recent surge in positive cases, several wards are full to capacity on a local and national scale.
COVID is tricky and it changes minute by minute. I mean, a patient can be in satisfactory condition, doing pretty well, and then an hour later go downhill very quickly.
Paige Jorgensen is a respiratory therapist from New York. She's currently working at DHC Regional Medical Center in Tuscaloosa. Jorgensen says it's considered a hot spot for coronavirus.
I've seen many patients from 20 to 40 with no serious health conditions pass away from this disease. So though it may not affect everyone drastically, the chance is still there, and I don't think it's worth it to risk it.
One of the biggest misconceptions, Jorgensen says, is just how serious it could be.
The situation is quite grim when you see it from the inside. We're doing the best we can every day, what we have, working our hardest, trying new things, trying things that have shown improvement for others.
So we try to keep the doors closed at all times. We limit our contact. We do not try to be in the room any more than we have to. We do basically bundle our care, if you've heard of that, and we try to do everything at one time and get in and let the patient rest, because that's ultimately what they need.
Jasmine Thomas is a graduate of the Mississippi University for Women School of Nursing. She has worked in 3 different COVID-19 units since the pandemic began. She's traveled from New Jersey, New York, and now is stationed at Maine Methodist Hospital in San Antonio, Texas.
I can definitely recall for yesterday, there were 301 cases, new cases that were reported. And here in the county, we also have over 69,000 since this pandemic has started.
Both are treating nearly 18 COVID patients and working 12-hour shifts. They say hospitals are even switching up the way patients receive their treatment.
How the RN controls the medication, all that's outside the room now. So we try to limit, patient contact as less as possible.
You have to gown up, put all your PPE on, and then take it off, leave the room, do it all over again. So it can be very time consuming.
While the future of the coronavirus is unknown, following guidelines is the best way to tackle it.
It's just a little nerve-wracking to know, where's the end? Where's the end of this?
And at this time, most traveling nurses are choosing to stay at their assigned hospitals longer to lower the risk of transmission of the virus.